today's conversation is part of our Cascading Impact series of conversations. So here at the Morris County Chamber of Commerce, one of our key goals is to really build bridges and foster relationships among chamber members. How do we do that? Well, we're always on the lookout for unique, fresh, and innovative programming ideas designed to help us achieve that goal. And a terrific example of that is something you're going to learn a lot about, and that is the Hands-On Philanthropy Program. Now, this program was brought to us by Jay Weissman of the Legacy Philanthropy Group, and Jay facilitated this through the Health and Wellness Committee under the leadership of Cascading. And you are going to witness through these conversations the profound impact this program has had on some of our chamber members. So the Cascading Impact interviews and conversation series is really designed to shine a light on these members and how things like intentionality, collaboration, and the spirit of innovation has had such a huge impact and can have a huge impact on so many lives in and around Morris County. So sit back and get ready to enjoy some wonderful conversations with some truly amazing people. Hi, and welcome to MCTV's Let's Talk. Today we're doing part of our series called Cascading Impact, and we are really blessed to have with us Team De-Stig. We have Dr. Jamie Pula from Abaddon Health. We have Lindsay DiStefano from Abaddon Health, and Lindsay is a certified health education specialist with a master's in healthcare administration. And we also have Mary Ellen Zung. Mary Ellen is a health coach, and she's also a lifestyle coach for the Lakeland Hills Y, specializing in diabetes education. So welcome, Team De-Stig.
Thanks, Mike. Thanks for having us.
Great to have you. So let's just start. Mary Ellen, what is Cascading Impact? You know, it's a new term that I hope that it gets more legs. So I'm just learning about it, but I think our members really need to know, what is Cascading Impact?
Sure. Well, a cascading impact is sort of like a ripple effect, right? So you start with something small and it just keeps growing and growing. And we're finding this with our Team De-Stig project with the Health and Wellness Committee. We started as a committee. We went through a hands-on philanthropy program that helped strengthen our relationships and build team. And now we are addressing the Morris County Chamber of Commerce committees, the Human Resource and Talent Committee, the Women in Business Committee. We addressed the ambassadors the other day. So you can see this cascading impact of our team's mission, which we'll talk about, right? It's going into, it's impacting individuals, it's impacting their communities, their families, and organizations within the chamber.
So yeah, there's a lot to talk about with Cascading Impact and what the model is. It's the giving model. So really, first I want to give a big shout out to Cascading of the Health and Wellness Committee for putting together such an amazing program, and Jay Weissman also for really digging in and showing us what this hands-on philanthropy is all about. So Team De-Stig, Dr. Pula, how did you choose the name Team De-Stig, and really what does it mean?
So we all stumbled upon the name Team De-Stig because we wanted to encourage those awkward conversations around mental health conditions, and automatically it provides a tool to engage one another on these conversations. So
mental health. So let's talk about what you guys did. So from my understanding, right, this is about finding a not-for-profit out there in the community and then getting behind them, right? So which not-for-profit did you guys choose, and how did you choose that, right? And then we're going to get into what your mission is. But really, you know, Team De-Stig, you know, you chose, I guess, something in mental health. So how did you decide that, and which not-for-profit did you guys pick to get behind?
So
Lindsay, sorry.
Go ahead, Lindsay. We'll
That's all right.
pass this to Lindsay.
Yeah, Lindsay, go ahead.
So the not-for-profit we chose was the Mental Health Association. And the way that we chose them was through a series of a matrix. And essentially we picked a vision, which we'll explain a little down the road. But they just align very clearly with what we kind of put on our matrix, which was essentially, what is their values? What are their programs that they do? How do they give back? What is their social network? How do they interact with their community? How are they pivoting during COVID and during all the other crises that we saw during the year 2020?
Mhm. So you picked the Mental Health Association of Morris and Essex, right?
Correct.
So they're a not-for-profit. Mary Ellen, what is Team De-Stig going to do to help them and bring this into the chamber as well?
Great. So Team De-Stig's mission is really to educate and provide awareness around the issue of mental health and to help destigmatize mental illness. So in partnering with the Mental Health Association, we are working on 2 projects specifically with them, trying to get as many people trained as in their mental health first aid training. So that's one way of helping to destigmatize mental illness. We're also working on a program for community companions with them, which is like a big brother, big sister program. And just with Team De-Stig helping to increase the number of people that are aware of the Mental Health Association resources, the trainings, that's going to help them sustain those programs in the future. And just it's their mission as well to help destigmatize mental illness.
Well, that's great. So we've got 3 incredible health professionals here that came together through the Health and Wellness Committee. How did you guys end up on Team De-Stig? And it's interesting that we have 2 people from the same company. Was that by design, or how did this come about, Dr. Pula?
No, there's no coincidence. It was actually a randomized process, and we were the most fortunate to have found each other. So there's not much, we can have hoped for beyond that. And the pairing, I have to say, is very, very intriguing, and it is beyond what I would have ever imagined it could be.
So you guys are working together as an amazing team. Let's talk about what you've learned and what you've been able to bring back to your company. Has Avedon Health or Mary Ellen, in your work with the Lakeland Hills Y, or your personal work, have you started to think differently? Has your company started to think differently about charitable giving, about time spent helping out those that need help, especially in the not-for-profit world? Lindsay.
So our company has kind of ingrained in this from the start. So one way that we have brought this back to our organization, personally, the way that I've seen it is with mental health first aid, right? So when I first started, we did a mental health first aid training for myself and 9 of my staff members. And it was implemented through a crisis protocol. So we were health coaching. And if we came across somebody, we had this resource available to them so that they would know exactly what to do and how to be better prepared in order to save somebody's life.
Wow. So that's really an amazing thing. And that could happen anywhere at any time. And especially now during the pandemic, where mental health issues have really been exacerbated. So
Absolutely, Mike. Just before, I have to just add to that, Lindsay did an amazing job. What she did once our care team members took the first mental health first aid workshop, is then she built on the foundation of these principles and developed the policy and procedure manual. So it's a wonderful application of this workshop and what it can do for organizations.
That's fantastic. So I'm going to ask a question, and each of you just give a quick answer, okay? And we're going to go in the order of Dr. Pula, Lindsay, and Mary Ellen. So how did it feel to be part of such a fresh and innovative program that gives back to the community? Dr. Pula.
Thank you, Mike. That's a very thoughtful question. So the timing couldn't have been better for me personally. During COVID-19 in the summer, it was an amazing opportunity to connect and to really get to know each other on a very personal level. at a time where we were probably feeling most vulnerable and socially isolated. So that's just one big, powerful impact that came out of this program for me.
Great. Lindsay.
I'm going to echo a lot of Jamie's sentiments. For me, again, the program could not have come at a better time. It was probably one of the hardest times of my life with my mom suffering from COVID. And this is kind of why I was very, very strongly wanting to talk about mental health. My mom spent 22 days on a ventilator from mental health and is still recovering. And thank God she survived. But this program kind of gave me an outlet to help everybody else that maybe is going through what I'm going through or some other mental health illness. But and doing it with my wonderful coworker and meeting Mary Ellen along the way, it was a perfect outlet for me, and it allowed me to give back at a time that I really needed it.
That's great, 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 great. Mary Ellen, you?
Yeah, and I have to echo what Jamie and Lindsay said as well. It couldn't have come at a better time. And I think that's what we're hearing from everyone that we talk to, is that we need to talk about this right now. Just personally, my best friend of 15 years committed suicide this summer. And so this is, mental health, and I couldn't recognize it, right? So if I had had these tools, I might have been able to do something about it. Is what I'm realizing.
Yeah, it's an incredible scenario that you're in, and then having lived through it like you did this summer, I can't imagine being in your shoes right now like that, and then learning all these great tools. What is next, Mary Ellen? What is next for Team De-Stig? You guys going to stay together? Is the band staying together?
We are so totally committed, as you can probably already guess. And, mental health is not going away anytime soon. Initially the hands-on philanthropy program and the teams were, we do a project and then we move on. But I think for all three of us, we're really committed to this. So who knows what's in our future, but we're not going away.
That is fantastic. Lindsay, any closing comments from you? Anything you want to say to the chamber?
I just urge anybody who is interested in learning more about mental health and our projects that we're hosting. We're hosting a mental health first aid. We are putting together an Into Yellow project. So if you want to, learn more, interested in social support, getting to know great people who are wanting to give back, contact any one of us and we'd be happy to connect you. It's an awesome cause and an awesome way to, give back to the community.
Fantastic. And any closing comments from you, Dr. Pula?
Yeah, so we just want to remind everybody that we have lots of colleagues under the Health and Wellness Committee umbrella, as well as across the committees in this phenomenal chamber. And each one of us may have very, very different but similar initiatives to impact this community that we're all serving. And so I just want to remind everybody that there's Roots and Wings, there's Nourish New Jersey and United Way, and so many others. And we just welcome you. Even if this is not necessarily your initiative, the vision is that you just get engaged, you find the joy, the reward is in the friendships, and the outcomes are immeasurable and intangible.
It's fantastic. So, this cascading impact, what we're doing in this series, I look at it kind of like a pebble being tossed into a very quiet pond, and those ripples are the cascading impact. And you guys are that pebble, and you've created such a huge ripple throughout the chamber community, throughout outside of the chamber as well. You're helping so many people, and we are so looking forward to you continuing with this. Our Health and Wellness Committee, Kathy Diagati, thank you so much for your leadership there. And thank you to Team De-Stig. Thank you.
Thank you so much, Mike.
Thank you.
Thank you. Bye.
So thank you all to our Morris County Chamber of Commerce members. We really appreciate your support. And if you are interested in being part of this cascading impact, just come to one of our Health and Wellness Committee meetings and you will be brought right into their open arms. Thank you all.